Personalized healthcare has become vital to the health industry as researchers indicated it can optimize health outcomes, strengthen provider membership relationships, and reduce overall healthcare costs. And joining me today is Dr. Lauren Maxim of ArchWell Health to tell us why this is so important for people to be checking on their plans and to making sure they're getting the best out of their plans, which we know that some people aren't. And that's where you guys come in. But let's get a little background about what ArchWell Health is all about.
Sure. So ArchWell Health, we're actually new to Phoenix, but we're a national primary care organization. We focus just on seniors. So all of our members are 60 and over. And we really focus on personalized health care. We like to talk to our members, get to know what's important to them, and help them make healthcare decisions that make sense for them. We know healthcare is not a one-size-fits-all industry. Lots of things need to be taken into consideration.
Yeah, and I think one thing too is that a lot of people, especially seniors, they don't use their health care like it needs to be done because sometimes they just check boxes because, maybe their friend told them or something like that. And then they look at the plan and then they don't realize what they can get out of it. Because I think sometimes we just look at what we get for our medicine and our emergency, but never look at the other parts that ArchWell shows you, and that is, community services that you can use. The physical therapy and everything like that.
Sure, and we can help really connect seniors to community resources. We have the time in our visits to really ask them about what impacts their healthcare. Do they have transportation challenges? Do they have food challenges? Are they socially isolated and they need to meet friends to help lift their mood, help improve their health? So we do those health screenings, we ask about those social determinants of health, and we can really help connect them with resources in the community. And we provide some of those resources as well.
Yeah. What I like too is that ArchWell Health is about talking with them. It's not so much of just getting on a computer, which a lot of our seniors don't know how to do or kind of afraid to do. And that's why you said you talk with them, because everyone's individual and you want to make sure they're getting the best.
Absolutely, and we always encourage our members, if they have questions, to just walk into our centers. We have same-day visits. We're available to really get to know our members. And like I said, it's important when you're making those big healthcare decisions to really have that relationship with your doctor, to feel like you're making those shared decisions and that they know what's important to you.
Yeah. Also, you guys have gone out and seen the research. You've done the research about, of course, connecting those seniors to the different plans and how important it is, and also seeing what's not being used and what can be used.
Exactly, and even through ArchWell as a primary care organization, seniors will have access to nutritionists, social workers, activity centers to create that sense of community. So it's important that when they're looking at their primary care, that they look at everything that is offered and what they might be missing out on.
Yeah. All right, I'm going to switch to actually people who have grandparents or parents who are in that age group. You're also there for them a little bit too, because you kind of like help them know where their senior parent is and what's going on with their programs. And that's something that's important too, about making sure the whole family knows what's going on.
Yeah, absolutely. I really feel like primary care is like the quarterback of a football team, and we really like to make sure everyone's on the same page. We like to make sure the patient knows what's going on and that all of the specialists that the patient may see are also on the same page. So communicating to family members, making sure family members are aware of treatment plans and goals is also really important.
Yeah, it's amazing. So we know that we had, so everybody has to understand too, so I think, what was it, last year, November or something, we had the
annual enrollment.
Thank you. And then we're finishing up kind of like where you can make the changes. I think it's
open enrollment.
Open enrollment says ended. And that's where you guys come in too, because again, you might have done the changes, you might not know what's going on, and that's where ArchWell can guide you.
Yeah, absolutely. And if anyone has questions about their insurance plan, they can feel free to stop into our centers. We can help navigate or help connect them to resources who might help them look down at what their benefits are and figure out what might be better for them.
I like it. Doctor, this is awesome, especially at this time where people are trying to figure out, of course, how to use their Medicare and of course, their health benefits. So
Yep,
how can
absolutely.
people find out more about ArchWell Health?
So they can go onto our website, archwellhealth.com. We have 10 locations all around the valley, so whether you live East Valley, West Valley, there's an ArchWell Health near them. And they can call the centers, come on in. We love giving tours. We're very proud of our centers. They're beautiful spaces. So we would love to see anyone who has questions.
Yeah, and they're growing, so you'll start seeing more and more pop up. So.
Absolutely.
Dr. Laura, thank you very much for joining us. Lauren, sorry, doctor. So thanks for joining us.
Yep, thank you so much.